Welcome to the Pharmacy Residency podcast. I wanted to talk a little bit about another podcast that I started, the Memorizing Pharmacology podcast, as well as 4 books that can help you through your APPEs, especially if you have one of those long commutes where you kind of just need to absorb that information osmotically. Is that how it would be? Basically making it audiobook university. So again, I'm Tony Guerra, pharmacist, and I wanted to talk a little bit about the pharmacology podcast and then some other books that may or may not be free depending on if you're an Audible member. So of course the podcast is free. It's Memorizing Pharmacology podcast. What I'm focusing on is the drug prefixes and suffixes to kind of increase your inventory of medication. So if you know the tidine suffix, which is episode 2, then you know famotidine, nizatidine, cimetidine, and ranitidine, which has been taken off the market. But again, good to know that it is off the market and what the issues are with that one. But then again, you've also got to kind of differentiate a little bit because famotidine is quite a bit safer than cimetidine. Cimetidine has all those CYP interactions, and I talk a little bit about those. Or, for example, episode 5 is the prazole suffix, where it can get really confusing because sometimes on note cards you'll see azole as a suffix, and from chemistry that azole is just a functional group. It has nothing to do with that. Prazole is for proton pump inhibitors like omeprazole and esomeprazole, and then you've got piprazole, which is an antipsychotic. So you've got Abilify and Rexulti, brexpiprazole. And then you've got conazole, which is fluconazole, itraconazole, ketoconazole, which is an antifungal. So there's some confusion about how to use the suffixes properly, but if you do use them properly, then instead of learning one drug at a time, you can learn many, many drugs at a time. So for the prazoles, we're talking about, I think there are 6 proton pump inhibitors. For the conazoles, I think there's at least 5 azole antifungals that are really in use. And then the H2 blockers, there's 3 that are in use. And so by learning those 3 suffixes, you've learned many, many, many medications. And then having that conversation keeps everything in your brain in good space, because I talk about this in the episodes, to always chart the medications your patients are on in order and always using GM-RINS, gastrointestinal, musculoskeletal, respiratory, immune, neuro, cardio, endocrine. By using the exact same order every time, what happens is, 1, you can catch duplicates a lot easier. Maybe on the chart, you saw the brand name for ACE inhibitor, and then you saw the pril ending on a generic of a different one. And no one caught that they were the same because one was brand, one was generic, or something like that. So again, that's really helpful. So, but Memorizing Pharmacology podcast, that's just going to kind of keep you up to date as I work through this. And really what I'm doing is I'm just recording this for my pharmacology students. I teach multiple pharmacology classes every semester. If you want the whole book and just a 7-hour listen, that's the Memorizing Pharmacology book. That's the most popular one. Just in a day, you can kind of pick up the 7 primary pathophysiologic classes: that gastrointestinal, musculoskeletal, respiratory, immune, neuro, psych, cardio, endocrine. And in endocrine, I kind of include renal and also some specifics to like male and female hormones and things like that. But Memorizing Pharmacology, everybody loves that one. Then if you want to kind of get into the weeds, a pharmacist read this, not me, Michael Lenz. He read Memorizing Pharmacology Mnemonics. So if you really want to get into a little bit more about memorizing those side effects and things like that, Memorizing Pharmacology Mnemonics is it. And then I worked with Eric Christensen, who is the MedEd 101 guy. on creating an Audible pharmacotherapy book, Clinical Pharmacy Pearls, Case Studies, and Common Sense, which is extremely popular as well. So it depends on what level you really want to start. And I know that as you're kind of going into your APPEs, your APPEs, or even the beginning of your residency, you're like, oh my gosh, am I going to remember everything I need to know? And especially for anyone thinking CGP or BCGP, that kind of thing, the pharmacotherapy book has patients on many dozens of drugs and talks about those kind of clinical pearls that you need to know. And the fourth one is one that just nobody can find, but it's excellent as well. The Thrill of the Case, which is a really cool title, but I begged him to change the title to The Thrill of the Pharmacotherapy Case, because it's just impossible to find, because if you put in The Thrill of the Case, it autocorrects in Google to The Thrill of the Chase. But this one, similar to the pharmacotherapy book, and more case studies, more drug interactions, more clinical pearls when you're talking about medication management. And then if you just want to, follow my channel, Tony PharmD, I have 31,000 subscribers. And some people just like to subscribe to this because as soon as a pharmacy residency podcast episode goes, you'll get it on YouTube, or it'll let you know. If you got to push the bell though, you got to subscribe to the bell. And then if you want the Memorizing Pharmacology podcast, these also automatically upload to that site as well. Okay, so 5 resources for you. Memorizing Pharmacology podcast, Memorizing Pharmacology, a Relaxed Approach, 7-hour audiobook, which you can get free even if you've never been on Audible before. They'll give it to you free, and I think on Amazon they'll actually give you 2 books. Memorizing Pharmacology Mnemonics, if you are a bit more advanced, maybe P3. And then if you are kind of P4, Resident Pharmacotherapy with Eric Christensen, that one as well. Or The Thrill of the Case for something a little bit different. And then you can always just Tony PharmD YouTube channel. But I wanted to make sure that you're aware of all these free resources and availability on Amazon and Audible, that if you've never had a book before, they will always give you that first one for free. Got questions for me, TonyThePharmacist@gmail.com. I was just looking on a Google search, and it's kind of funny. Tony the Pharmacist comes above forecasts when you put in pharmacy residency podcast. So I just thought that was kind of neat that many of you are listening. And I mean, I know the stats, but again, I appreciate it. And if you do have the chance, please do subscribe to the podcast. Do subscribe to the Tony PharmD channel. It makes it easier for Apple to know that, oh, okay, we need to put this out there so that more people are able to get this great content. Okay, so thanks again, and we'll talk to you next time.